Fair Use Act Disclaimer.
Yeah, it's Moana, baby.
Uy! Kumusta? Last 2 episodes na lang. Stay tuned na! Again, I'm Bobrick Mendoza, and I will be your guide for today's Moana series, episode 21. If you are ready to learn and explore the wonders of Moana, ano bang hinihintay nyo? Let's go! In this episode, we will discuss about the abdominal region. Our abdomen is a region that lies between your diaphragm above and pelvic inlet below. This is primarily a soft tissue region with little bony framework. Therefore, an intact abdominal wall is essential for the support of abdominal content or mostly of your organs. So, before we start with the muscles and movements, let us first discuss briefly the different quadrants of our abdomen to help you visualize and determine the position of each structure. Normally, we have two methods that help us divide our abdominal pelvic cavity into smaller areas. However, we will only discuss the first method, which divides your abdominal pelvic cavity into 9 regions. First is your right and left hypochondria, your epigastric, your right and left lumbar, your umbilical, your right and left inguinal, and lastly, your hypoepigastric. So, those are your 9 abdominal pelvic regions. So now, let's proceed for the most exciting part of this episode. Ready na ba kayo makakita ng abs? How about quarantine tabs? Joke lang! Of course, let's make this episode more educational. Remember, our abdominal region has 2 walls. Your anterior wall and your posterior wall. And to mention, we have already discussed the posterior wall of our abdominal region. These muscles are your iliopsoas, or your psoas minor, psoas major, and iliacus, which have been discussed in episode 10. So now, we will only discuss the last muscle of the posterior wall, which is your quadratus lumborum. The last muscle in our posterior wall is our quadratus lumborum, which originated in iliolumbar ligament, iliac crest, takes the transverse process of lower lumbar vertebra, and which is inserted to your 12th rib. It is innervated by lumbar plexus, and it can fix your 12th rib during expiration, and it can also depress it during forced expiration. It can also laterally flex or vertebral columns on the same side. Again, that's your posterior wall of abdominal region, your iliopsoas, and your quadratus lumborum. Now, we may now proceed to the anterior wall of your abdominal region. To start off with the most famous muscle of abdominal region is your tabs. Joke, of course, it's your abs or abdominus rectus, which has linea alba that divides it into your left and right, and also it has tendinous intersections that divides it into different compartments. That's the reason why we have 6-pack abs. Your abs also has linea semilunaris that forms a curved ridge at the lateral margin of the abs. It is originated from your symphysis pubis and pubic crest, which inserted your xiphoid process and 5th to 7th costal cartilages. It is innervated by your lower 6 thoracic nerves and ventral rami of your T7 to T12 of intercostal curve and subcostal nerve. It compresses your abdominal contents, and it flexes your vertebral column and accessory muscle for expiration. Next to the list are your external oblique and internal oblique. Both muscles are innervated by the lower thoracic nerve and iliohypogastric and ilioinguinal nerve. And and their actions are to support and compresses the abdominal contents. It also assists in flexing and rotation of your tracts. Lastly, it can assist in forced expiration, micturition, defecation, parturition, and vomiting. However, they have different origin and insertion. Your external oblique is originated from the lower 8 ribs and the 5th to 12th ribs and inserted to your xiphoid process of sternum, linea alba, and pubic crest, pubic tubercle, and iliac crest. Your internal oblique is originated from your lumbar fascia, iliac crest, and lateral 2/3 of inguinal ligament. It is inserted in lower thoracic ribs and costal cartilages, xiphoid process, linea alba, and symphysis pubis. The next muscle is your Transversus Abdomenis, which is also known as your corset muscle because it pulls and compresses your abdominal contents. It is originated at the lower 6 costal cartilages, lumbar fascia, iliac crest, and lateral third of inguinal ligament. It is inserted at your xiphoid process, linea alba, and pubis symphysis. It is innervated by your lower 6 thoracic nerve and ilio-hypogastric and ilio-inguinal nerve. Its action is, of course, since it is a corset muscle, it compresses your abdominal content. And for the last muscle is a small muscle that lies in front of the lower part of rectus abdominis. However, it is often absent. It is your pyramidalis. It is originated at the anterior pubis and inserted to your linea alba. It is innervated by your 12th thoracic nerve, and of course, its action is to tense your linea alba. There you have it. We are done. I'm sure you picked up a lot of important details in our Moana episode today. To make it greater, we prepared some tips for you. Here are the techniques that you can use in memorizing the Moana. First is creating mnemonics. There are already some mnemonics we usually use as PT students. For example, for the actions of muscles, we use adhere, faber, and sabir. And another example is for the groups of muscles, such as your seats and FEU. Creating mnemonics has no limitation. You can use all your creativity to make your memorization effective and fun. Next tip is to make a game. Of course, after all your memorization, you need to assess yourself. In doing so, we can be creative and fun by making a game out of it. It is less toxic, less pressure, and can make your study enjoyable for you and for your friends. So, it was amazing to discuss the Moana of the abdomen with you. Always remember to have fun learning, and this will This will be my last episode. However, we still have one last episode. So, keep yourself stay tuned. It was amazing to discuss the Moana of the abdomen with you. Always remember to have fun learning. This will be my last episode. However, we still have one last episode. So I hope you keep yourself stay tuned in. Till next time, bye!